Another very great doctor here who is Dr.Sussovana Nair. Yes, and she is a medical oncologist working at Kuwait Cancer Control Center. Everybody knows her, and she's been very helpful. So I'll leave the floor for her so that she can tell and help you all with great.
Assalamu alaikum and
Walaikum
good
assalam.
afternoon everyone. And I'm feeling short of words to thank you from the bottom of my heart to thank you for all those lovely words. I hope and pray to Subhanallah that I really deserve those superb words. Thank you so much once again. And also thank you dear for having me here.
No, thanks a lot to you.
I cannot make my talk so interesting like Dr. Sajda's because that is all related to beautifying ourselves. My topic is very boring, my topic is very scary, but still I'll try my best to speak the things which sounds good. So that person is not going to live long. But actually that is, that we should say as oncologists, that sounds very bad for us, like we are helpless or we don't have any knowledge, we are not doing anything. It is just like an iceberg. The people who are suffering from advanced disease is actually a small population, but there is the bigger bunch which are actually in the survivors group. Yes, the incidence of cancer we cannot stop because it's based on our lifestyle, and our lifestyle is becoming more and more bad. We are all going away from nature, so we are all going closer to cancer, which is also mentioned in our oncology books. So we have to be more towards the nature. So the thing is, the incidence we cannot stop. Incidence is rising. The good point is that death from cancer is on the downgoing trend. So that is basically because of awareness sessions and ladies picking up their breast cancers early. We know breast cancer is the commonest cancer all over world. Whichever part of world you take, breast cancer is the commonest. When it comes to men, there are different parts of world have different organs, which as actually the top list. Like Western world, we have more of lung cancer. But in Arab world, generally we find more of colorectal cancers here. Though we should think of lung cancer more because people are more smoking. But why colorectal cancer? This again comes because of smoking plus red meat eating, which is roasted basically. I'll put a few points on roasted meat eating and their side effects or adverse effects. So basically, the fear we can bring it down by saying that the breast lumps that we generally come across, 80% of them are benign lumps. 80%. So then what are we dealing with? Cancer all over world, breast cancer, commonest cancer, so many deaths, young ages. So it's basically 20% of lumps in the breast which are cancerous. That too are causing cancer, causing the fear because we are getting diagnosed late. Yourself or pick it up early. So that is what we are going to discuss here. So, cancer, it's a disease which starts at the cellular level, from the cells. As Dr. Sajda mentioned, we have a basement membrane. Okay, the basement membrane is one of the strongest membranes on which the cells are growing. Any part of the body, any collection of cells, generally there is a basement membrane on which the cells are growing. And it is a controlled way of growth. As she said, that the dead cells, the old cells, they have to die, new cells have to take their place. So this happens in a controlled way in our body, in a normal body. When there is some stimulation which can damage the DNA of the cell, who is controlling this growth rate and the cell after senescence they have to die. So who is controlling this? If we think on another level, like in godly ways, we think it's God who is doing all these things. But medically we say it is the DNA or the chromosome which is controlling the growth rate of the cells in our body. Now, what happens if there is any stimulus which can damage, anything that can damage the DNA of the cell, which is controlling this controlled rate of growth of or development of the cells, then the cell starts proliferating in an uncontrolled way. And this haphazard way of growth of cells is basically a developmental process called carcinogenesis. Cancer genesis. Carcino means cancer, genesis, development. So when we think of cancer genesis, Say for example, I take this is the basement membrane, any part of the body, this is the membrane on which the cells are growing. Now 5 cells, their DNAs have been damaged by some agent. Either it is radiation or it is some sort of a drug, whatever chemical has caused damage to these 5 DNAs. So those 5 cells will start developing or proliferating in an uncontrolled way. So when they start proliferating in an uncontrolled way, what happens is their growth rate, the cycle, the growth rate, proliferation, everything becomes haphazard. They go full chaotic. Which way? Suppose a cell has to grow after 2 minutes. Every cell has a doubling time, right? Suppose the cell has a doubling time of 2 minutes. But now it will not double after 2 minutes. It will double after maybe 1 second. So just think, cells are not 1 or 2. Our body is made up of trillions of cells. Now, if it doubles, which was supposed to double after 2 minutes, is doubling in 1 second, just think of the logarithmic growth rate of the cells. It will just like proliferate like anything. So 3 centimeter, and when I examine her underarm area, there is no lymph node. So I tell her, get your CT scan or a PET scan done. And CT scan or PET scan shows there is nothing in the liver, nothing lung, brain free, everything free. And I give her good hopes that as per the scans, I don't say that there is no cancer anywhere. As per the scans, your tumor is only in the breast, nothing in the underarm area, nothing in the liver, lung, bone, brain, anywhere. So, actually, it will be haram on my part if I tell her there is no cancer anywhere. Okay, because I cannot count each and every cell. And if it is 400 cells, 300 cells in the circulation, that will never be picked up by any of the investigation modalities that we have till date. We call PET scan is a big investigation, but it also has limitations. It can pick up maximum 6 millimeter, and 6 millimeter means it's like more than 10 to the power of 9 cells. It's a see, PET scan also has a limitation. It cannot pick up cells in cluster of thousands. It cannot pick up. If it is more than that, maybe it can pick up that there is a hot spot. You know, if you have seen a PET scan report, it will say something called SUV. So SUV is 5.6. It doesn't say it is cancer, not cancer. It says SUV. Then as an oncologist, we have to correlate whether I am thinking on cancer or no. I come back to the same point. So I got the patient, 3 centimeter mass in the breast, nothing in the underarm area by examination. Mammogram, it's showing there is nothing in the armpit, and CT scans or PET scans are clear. It's only the breast mass. So as per scan, she is an early case. Okay, we started chemotherapy. So early case means our treatment intent is curative intent. I tell her we will try to cure you fully. Okay, cure you fully means I'm going to remove the full cancer from your body. So she thinks the cancer is never going to come back. So we give her chemotherapy, make the tumor small, tumor almost melts, and then we send her for surgery and they conserve her breast, and she just has a scar mark on the breast, the tumor is gone, lumpectomy. And she goes for radiation, and based on the histopathology, the biopsy report, we give her hormones or we don't give her hormones, and the chemo will come. Now, I cannot tell the patient goodbye, you need not come back because your cancer is fully gone. No, we have to keep her under follow-up. Okay, because this patient may come back another 4 or 5 years, 6, 8 years, 9 years, 10 years, even sometimes 12 years later we are getting recurrence. So this patient now, every year she is doing her metastatic workup, she is doing her CT scans, PET scans, but nothing is seen, nothing is seen. All of a sudden, one day she is admitted in Mubarak because of severe cough and breathing difficulty, and they find there is water in the lungs. When they take the water from the lungs and they send it for a cytology study, they say there is cancer cells. They do further study, we call it immunohistochemistry, that shows these cancer cells are from breast. So she was treated 7 years back, everything fine. How did these cells come here? So it is not all of a sudden, it's not atavistic, it's not coming all of a sudden. Picked up on the examination. Now, when we examine ourselves, we always look for some lump, isn't it? We always try to look for no lump. Lump means it's already more than 10 to the power of 9 cells or more than that. So you have to pick up the subtle changes. See, as Dr. Sajna was saying, that skin is one of our most, not one of our, it's the most protective organ in our body. It is really most protective organ in our body. So when we palpate our breast, You all of us know how our breast feels, right? How we, when we palpate, how it, the touch, the texture, we all know. Now, you don't have to look for a lump. You have to look for any subtle gritty change. Like, you know, I touch my breast, feels like this. One day you touch, you feel, no, this is not the normal feel. Like if I hold my sari here or hold my sari here, it's not the same feel, right? This is much smoother than this part. So if I feel that always I feel my breast this feeling and today I'm feeling this, is surely it may be some new change. So this is what we have to pick up. Also remember, as I said, 20% only are the malignant changes, 80% are benign. So the stigma that we all generally have in the society, that if it is cancer, then again I'll be a cancer patient, KCC, all this, hair loss, everybody will call me a cancer patient, I'll not be able to join every group, my look. You need not have to think of all those things. Always think, if I can pick up today, cancer treatment will be a past. It will be in the history. She was treated for breast cancer. That sounds much better than keeping it, holding and keeping it neglected and getting diagnosed when it really has pain. Because you know, cancer is a disease which cannot be having symptoms, or it doesn't have symptoms in the early stage. Generally, whenever there is a lump in the breast without pain, please think it is cancer first. Please think it is cancer first. If there is a lump in the body, not only breast, underarm area, anywhere in the body, painless lump growing in size, please get a biopsy done. Have a clinical opinion, what is it? Painless lumps, generally not cancer. Generally. There are some breast cancers where also it starts with pain and there you don't find a tumor, the full breast looks like a reddish hot looking growing mass. Now something regarding how do we, or what are the different types of cancers that we find in breast. Generally, cancer, you know, breast cancer develops in the ducts or the lobules. Lobules are what? The milk sacs, where all we are called mammals, or we have mammary gland for the production of milk. So these lobules, the alveoli-like structure where the milk forms, cancer can start there, then we call it lobular cancer, or it can start in the tubes which come from those lobules bringing the milk up to the nipple. So they are called ducts or tubes. So ductal cancer and lobular cancer. These are the commonest. Now, there are other two cancers. One is, as Dr. Sussovana was saying, the scaly lesions, you know, dryness. So there is something called eczema, right? You all know about eczema. It's a dry, skinny disease, rashy disease, itching. If anybody has around the nipple, around the areolar area, a dry, skinny, eczema looking lesion, but it is only in one breast, please have an immediate cytological examination. Because if it is unilateral, it may be an early sign of a type of cancer which we call Paget's disease, named by the discoverer, the person who discovered this cancer. So it starts like scaly disease. Okay, so that will be very early pickup, and maybe she will not even need chemotherapy. So that is the most important thing that we don't want in cancer treatment. We don't want the patient to have chemotherapy because that causes the maximum damage to the body, looks and everything. So this is another Paget's disease. And the fourth type of cancer is the inflammatory breast cancer, which is more common, you know, during the pregnancy times. Like lady is pregnant, already her breasts are getting milk and large size, everything. That time she gets a cancer, which is very unfortunate because generally it is misdiagnosed as it is because of the milk forming ducts and lobules, and that's why the breast is increasing. But she may be feeling some other symptoms. One breast is painful, and sometimes it's neglected also and misdiagnosed also. And the full breast becomes red, hot, mass looking thing, and that is really painful from the very beginning. So these are the four different types of cancers that we get. Incidence is very less. It is only 1 to 3% of the breast cancer populations are males. But the sad part is that the cancers in males are generally diagnosed late. That is again because of same thing, that gents generally never want to think that in that small nipple structure, if there is a small pimple-like growth, they don't want to think it on the line of cancer. Something is there, and moreover it is painless. Okay, so it keeps on growing, but it is after all cancer. So keeps on growing, so what will it damage? Basement membrane. So once it is damaging the basement membrane, means if it is neglected and kept in that place for a long time, it damages the basement membrane. So once the basement membrane is damaged, entry into the blood circulation. So the cancer cells go into the bones or liver or lung, and generally male breast patients, we get them from different hospitals because of the symptoms of the metastatic disease. Like recently we had one patient from Al-Razi. He was shifted bed to bed transfer, hospital to hospital transfer. He was admitted in Al-Razi with low back pain, severe low back pain and numbness in the lower limbs, like cord compression symptoms, They did a biopsy from that spinal bone here, L3 or L4 vertebra, and that vertebral metastatic, that came as metastasis from breast origin. So then they asked, Baba, you have any problem in the breast? He said, yeah, fi hada varma hada makushe makuawar. So he is keeping that since last maybe 4-5 years. So that is cancer. So he came to us bedridden. It's almost like bedridden means we have to give physiotherapy. We don't know whether he'll come back to walk again. So that was the breast lesion which was neglected. So male breast cancers, though very less in number, very less incidence, but it is very risky because they generally get neglected. Cause, direct cause. What is the cause of cancer? So really it will be very difficult for me to give cause for this patient, this patient, this patient. It will be very difficult. Because for any cancer as such, we don't have a direct cause for that particular cancer. Except for lung cancers, where 90% of lung cancers are related to smoking. 10% may have some different etiology. Now, for breast cancers, generally we discuss on the risk factors. We have to understand that breast, ovarian and endometrial, these three cancers actually are estrogen-driven cancers. If I have more of estrogen in my body compared to another lady XYZ, then I have a high risk of developing one of these cancers compared to her. What is estrogen? Estrogen is the one which is making us all look beautiful. So estrogen is the female hormone, which we start producing from the day of menarche, when we start our periods. Now, more the estrogen, higher the risk. So which ladies will have higher risk? Now, if I take out estrogen level from the blood for all of us will not have the same level, right? All of us will have different level. So there is a level based on from my birth, like how my mother had, so I will be having similar range. So somebody may have since birth high level of estrogen. So surely that lady will have a higher amount of estrogen in her body. Now, take a lady who has a menarche at 10 years of age and a lady who has a menarche at 13 years. So who is more protected? The one who gets at 13 years of age, because at least those 3 years she did not have periods. Because what happens during periods, there is a time when we call estrogen upsurge. There is a day when there is a sudden high rise of estrogen level in the body. So a lady who has periods every month, so every month there is a day where there is high level of estrogen. Now when there is continuous periods every month, there is a cumulative growth of the level, right? Every day, every month there is some level, next month again some extra level, next month. So if I take two ladies, one is a lady who gets pregnancies, and one lady who is not planning for pregnancies or who is unfortunately having no kids. So who is more risky? The one who did not get any pregnancies, right? Why? Because every month she is having periods. Every month her estrogen is high. But a lady who got pregnancy, it is naturally, she is amenorrheic. So 9 to 10 months because of her pregnancy, she is not having periods. Now, if she is lactating her baby, then this is God-gifted contraception. She'll be again another at least 6 months protected from periods. Generally, our mothers and all, they never knew any contraceptive methods. But we are 4, but all of us gaps of 3 years, 4 years, 7 years. So this is our natural protection from God. So this is natural amenorrhea because of lactation. So one pregnancy is protecting the lady by nearly 1 year and a half. But a lady who never got pregnancies or who aborts her pregnancy by giving some tablets or some injections, it is very easy nowadays. I don't want the pregnancy, one injection gone, next periods, baby is out. So whenever we are doing something against the nature, this is not God's plan, right? We are supposed to be mothers when we really want to be mothers. So when we are doing something against the rule of Him, surely we have to suffer. So the lady who is not getting pregnancies because of some issues, or who is damaging her pregnancies or destroying her pregnancies by external estrogen, all these ladies have high risk of developing breast cancer. Similarly, the ladies who are postmenopausal. Postmenopausal, what happens? Hot flashes. Western world, hot flashes is not the issue. Vaginal dryness is what they suffer from, because their sexual life is very, it's like they want to live in that life only. So they cannot tolerate the vaginal dryness. Dyspareunia is the commonest cause for which they go for hormone replacement therapy. What is hormone replacement therapy? Again, back estrogen into the body. So all these people who are taking extra estrogen into the body, they are increasing the risk of breast cancer. Now, these are all the causes which are controllable, which we can keep it under control. There is another cause which we call obesity. Very common, right? None of us want to work much because we can give a call, food comes home. We are gaining more and more fat which is not required for the body. We are supposed to eat how much is just required for the body's need, not just because we are living, so we should keep it in. No. So what happens once we are menopausal? Our ovaries are non-functional. So surely my estrogen levels should be down because ovaries are not working anymore. But if I am obese, extra fat in the body, actually, hormone production is in a cycle. It's in a cyclic formation. It's not like directly it is produced. There are some chemicals, this has to mix with this enzyme, then this one. This to this, then this enzyme, then this. So what happens when a lady is obese in postmenopausal age group, the extra fat, they actually can convert, some percentage of that can convert to estrogen. So this is we call extra endocrinal production of estrogen in postmenopausal age group who are obese. So again, we are increasing the risk of high level of estrogen in our body when we are obese in postmenopausal age. So please try to keep your weight under balance from the time you have crossed 40, because all of us will have different ages for postmenopause. So we have to understand that light exposure to our body, this is very important. There were some studies conducted in some parts of Korea, some parts of Japan. They wanted to study why nowadays we are getting so many young breast cancer patients, especially nurses, hospital nurses. Really, even when I studied, I still remember oncology, as students we used to take the FNAC. That time as students we had to take the biopsy from the FNAC, So most of the ladies who have come to the OPD will be all elderly ladies, 50, 60, 70. So they are all waiting. So we have number of, maybe I have 5 cases, she has 7 cases like this, and we have to take. Nowadays we are getting ladies who are like, I have even a 19-year-old lady, 24, 35, 36, 40, 41, all in, mostly in this age group. So that study was conducted to find out why so many young cases, and that too, they did not have family history. Now most of us think like that, right? Why should I think of breast cancer? My mother doesn't have breast cancer, my family doesn't have. You have to understand this familial predisposition of breast cancer is limited to only 4 to 6% of the population. BRCA1, BRCA2, have you heard? BRCA1 and BRCA2, these are 2 types of genes which are prevalent in some population where the cancer risk is higher. But this is in a very limited population, means hardly. Some books say it is 4 to 6%, some books say it is 3 to 5%. Anyway, take it for 6% today. So 6% of population have this risk of familial. Then what about the rest 94? So rest 94% are getting the breast cancer because of familial history, because of their lifestyle. So basically cancer is a lifestyle disease. So what they found that these nurses who are getting cancer but they don't have family history, then what might have been the cause? So they found that in a nurse, you know the nurses, their duty time, they go from 7 to 2, 2 to 10, 10 to next morning. So say for example, nurses generally we think younger age groups, right? Doctors mean generally old ones, but nurses means younger age groups. all the hair will go off, will all be with multiple colors in the hair to look young, but everybody knows our age. So nurses means younger age group. So younger age group means her ovaries are working. She goes for supposing night duty. Okay, so night duty means Night duty means in the morning hours she is working at home. Afternoon she may be sleeping. Night she goes for duty. Okay. Now, come back to something else now. In our brain there is a gland called pituitary gland. Okay. What is pituitary gland? Pituitary gland is a gland which produces some hormones which are actually controlling the other endocrine organs in the body. Okay. So how much estrogen to be produced, how much thyroxine to be produced, all this is governed by this superpower. Now, this pituitary gland is again controlled by the light radiation, light exposure. If the light falls on the pituitary gland, from my retina it goes to the brain, so it gives the stimulation to the pituitary gland, produce estrogen. And if it is dark stimulus, that stimulation tells the brain that produce melanin, as Dr. Sussovana was saying, melatonin. So melatonin, melanin, these are the different stages of the same hormone. So if I'm in pitch dark, that time my estrogen production is less. If I'm in light, my estrogen production is on. Now brain doesn't understand natural light and artificial light. It is light stimulus it produces. Now the lady, the nurse who is going for night duty, morning she was working. So working means in bright daylight, estrogen cycle on. She's young lady, ovary is already on. She may be under some contraception because her child is small. Again estrogen. Now afternoon she takes rest to do the night duty, but she's not in pitch dark, right? She's sleeping in, windows are closed, lights are all off, but she's in daylight. So estrogen cycle on. Night again estrogen cycle on. Bright light in the hospital. So basically she is producing estrogen 24 hours of the day. Same thing if the lady is sleeping in pitch dark, this production is less and she'll be producing more of melatonin. So melatonin has many functions. Melatonin, as Dr. Sussovana said, it's a protection from cancers. If I'm more darker, means I'm rich in melanin, I'm protected from many of the skin cancers, basal cell cancer and all these things. Also, melatonin is the hormone which gives me sleep. You know, most of us who are watching mobile in the night, we don't fall sleepy, right? This is because this melatonin production is reduced. We are again producing estrogen. So we don't feel like yawning, we don't feel sleepy. So you can keep on watching the mobile, the full night goes off. Because you're sleepy, that feeling is not getting produced. Okay, so this study showed that the ladies who are exposed to light more and more, they have a more risk of developing a breast. Even if you have to do really some work in the night, try to use a night lamp so that the light is not traveling directly, you know. Light travels in rectilinear propagation, straight line. So if my night lamp is under the bed, in Western world you will find, generally night lamps are down. So when you switch on the light is not falling directly in your eyes. So at least you are protected from continuous exposure. Also, obesity. Avoid any sort of contraception by hormonal intake. You can always go for some what do you call? IUD is also, actually that also has hormones. It is that is better. Or if you have completed the family, go for ligation. That's the best thing. If you have completed the family.
I think I should take that blame of missing one.
Yeah, no, that's actually important. So this is one thing. So also be very close to the nature. Try to take out at least 1 hour for yourself because you are the pivotal point in your family. Once we are sick, our family is totally down. So take care of your health. If you can take out at least 1 hour in your day to go out into the greens, that oxygen, it's said that every time we are collecting lot of radiations in our body, which can bring about cancer generation in the body. None of us know whether there are some cancer cells already in process. But I can fight it out, I can kill it by making myself more immune. That is why lot of oxygen in the body. Because cancer doing right hand for the left breast underarm area, left hand right breast underarm area, and the palpation should be, palpation should be really hard. It's not like you're not touching softly. Palpation means you're touching your breast, you're trying to compress the breast tissue in between the palms of your fingers and the ribs so that you can make out any subtle change, any gritty feel, any like sandy feel. That can be an early sign. Don't look for lumps and never examine with the tips of your fingers. Tips of your finger, anywhere you touch now, you'll find a lump there. That is a wrong method. Also, when you have to examine the underarm area, please don't examine like this. Examine like this. only breast examination, you can do like this. Underarm area, hand should be down, because like this, there's an axillary pad of fat. Inside the axilla, there's a bunch of blood vessels and nerves. We call it brachial plexus, which is a very important organ inside. So to protect that, God has given a axillary pad of fat. So that actually pushes out when I put it up. So many people think that they have a check, like any nipple change, any small pimple lesion, anything which you did not find the last time, any nipple distortion, any scaly lesion, anywhere in the skin there is a small dent area. Ladies who are premenopausal, if there is any time nipple discharge which is bloody, reddish coloration, please go and have a check. Have the cytology of that nipple discharge. Because young ladies' bloody discharge, 99% times it is a cancerous growth. But if it is postmenopausal ladies, sometimes it may be some other benign diseases like duct ectasia. There is a dryness of the ducts, so that can be a benign condition. So this is one thing. Examine yourself every month once. Don't examine every day. If you examine every day, even there is a new growth, you cannot pick it up. So always have a gap to examine yourself. And with that, I should stop here.